Hi, everybody. Thanks for joining us today for our first parent prep workshop. I'm Krista Matthews. I work for Concord Counseling as a prevention clinician. I'm based at Genoa Middle School, and Kristen is going to be our other presenter today, and she's going to introduce herself in just a second. We wanted to go over just a few things with you guys. We want you to be a little bit patient with us and flexible because we are new to this virtual presentation platform. So be patient with us. We're going to do our best here. We can't see or hear you, but you can send us questions to the Q&A box at the bottom of your screen, and we'll answer those as much as we can. We're going to pause throughout the presentation so that we can do that. Also, just so you know, this will be recorded, so you can come back at a later time and watch it. So now I'm going to have Kristen introduce herself real quick.
Great. And we will try to speak up for you guys throughout the presentation. So just know we will try to be mindful of that as we go. Again, as Krista mentioned, I am Kristen Hammonds, and I service mental health here in the district at both Heritage Middle School and Whittier Elementary. And just to kind of let you guys know who we are before we talk about mental health for this session is I want to kind of like put a face with a name of maybe what clinicians and school counselors might be in the buildings for your kiddos. So I'm going to first pull up the link for the Westerville student well-being page. So if you click on that link, here we are. Not only are there great resources and links on here, but my favorite part is if you scroll down a little bit like I'm doing and click on K through 12 school counselors and clinicians, that is going to bring you to all the schools, not only the school counselor there. So if we go down to Whittier, we have the school counselor. You also have me listed. And then when we go to Genoa, you have the school counselors, and then Krista's there too. You click on the names, that is going to take you to the email, and there's also phone numbers listed. So it's always nice to know where resources are here in the district. And I just wanted to show you our student well-being page to start off. All right, so I am going to go back to our presentation, and Krista is going to actually start us off to talk about depression.
Okay, so we're going to go ahead and just dive right in. We're going to talk about warning signs of depression. And first, I just want to go over some misconceptions because I feel like it's a term that is used a lot. It's tossed around a lot, and oftentimes it's misused. So depression is definitely more than just feeling down. It's not something that somebody can snap out of, though I feel like we hear this sometimes about, just choose to be happier. So when somebody is truly depressed, this just is impossible. It's going to take a lot of coping skills and possibly counseling to help that person come out of those symptoms. I also want to note, there can be situations where a person can experience depressive symptoms where, they're not necessarily diagnosed with it, but they're experiencing the symptoms, but they get better within a shorter amount of time. So as counselors and social workers, what we look for is how long has a person experienced the depressive symptoms and how severe is it? So we want to know how it's impacting everyday life. So is it impacting relationships and school and extracurricular activities? And it's this true persistent feeling of sadness and loss of interest. And you'll hear me kind of talk about how depression is a whole body experience. So it affects a person, how they think, feel, and behave. It can even kind of change personality at times, and it can affect us physically as well as emotionally. Thanks, Kristen. So here are some of the signs of depression, and they're definitely not limited to this screen. And also, mental health is unique to each individual. Somebody could be experiencing depression and not necessarily exhibiting all of these signs, but these are some of the most common ones. So first here on the list, and I would say the hallmark sign of depression is a sense of hopelessness. So, you might be talking to your kiddo and they're talking about, they're just not looking forward to anything. They may not be very future oriented. That's going to be something that we want to take a closer look at. Difficulty focusing is another common sign of depression, no longer participating in activities and hobbies. So when I have a kiddo telling me, maybe their friend who was in basketball and student council and drama club is, not participating in any of those things anymore and no longer is interested, that's going to be something that raises some red flags for me. There's an overall lack of energy and sometimes fatigue, lack of motivation that you're going to notice, feelings of being unable to meet expectations. So this one we'll see at school a lot where, kiddos might say something like, I just give up. It doesn't matter. I'm not going to be able to get that grade or pass that class. So it's this overall feeling of, I'm not good enough. I'm not going to be able to meet that expectation. Um, Poor self-esteem and guilt is often common. Problems with making decisions kind of goes along with that difficulty with focusing. So if we can't focus, it's going to be harder to make good choices for ourselves. Isolation is another key kind of sign. And this one I talk with parents a lot about, especially when it comes to the middle and high school years, because our kiddos want more privacy. They want alone time. And so, I tell parents to, pay close attention to when they're alone. Are they maybe talking to their friends, or are they completely just isolating themselves? Are they no longer spending any time with family, whereas they used to, come down for a movie or dinner? So we want to explore that one further, especially with the older kiddos. And then we're going to see changes in sleep and appetite oftentimes. This is either, sleeping way too much or insomnia. I see with my kiddos sometimes that change in appetite where suddenly they can't explain it, but they just have no appetite at all. And that can work the other way too, where you might have a kiddo who is overeating or maybe eating as a source of coping. And lastly, here on this slide is suicidal thoughts or behaviors. We have a whole section devoted to that in this presentation, so I'm not going to go too in depth with it, but just know it's another, sign of depression. So now we want to talk about the do's and the don'ts. So first on the list is just listening. That is the most powerful tool in your toolbox. And it's way easier said than done. I think we oftentimes, and I fall into this all the time, we want to fix things for our kiddos. We want to solve the problem for them, but it's really important to, just actively listen and reflect back what you're hearing. So if you've got a kiddo who's telling you, I am just so nervous for this test, I know I'm going to fail, and talking about maybe some peer conflict that's going on in their friend group, just reflecting back, it sounds like you're really nervous about this test. It sounds like this is really stressful time right now with your friends. You would be surprised how much more they're willing to talk to you, and they're like, oh, they get it. Like, you hear me and you understand how I feel. We want to stay calm and logical as much as we can. Again, not always the easiest thing to do when our kiddos are really, feeling upset. Using empathetic statements and being careful not to compare maybe to other siblings or get too caught up in our own experiences, but just really trying to put ourselves in our kiddos' shoes and understanding their reality. Next, I have reducing the stigma, and I always like to talk about this one because our kids listen to us when we don't even realize it. They take in things all the time. And so if we are, saying things like, oh, that person is just so ADD, they can't focus at all, or they're an anxious mess. Our kids hear things like that and they start to make these kind of like unconscious decisions of who's a safe person and who is not. So we want to be careful. It's the small things. And then seeking out help. So this could be, your school, your kiddo's school. This could be a pediatrician. This could be your own support system. So just seeking out help when you need it. And then on the other hand, I just have a few things that you want to avoid. So we don't want to minimize and judge feelings. Like I said, we want to really actively listen and reflect back what we're hearing. We don't want to encourage guilt. I can't tell you how many times with my middle schoolers how often I've heard that that kind of thought of, oh, you can't tell mom and dad this because it's going to stress them out. I don't want to be a burden to them. So we want to be really careful about, how we're having conversations with our kids and not encouraging any guilt, especially when they're experiencing some depressive symptoms. We never want to dare a person on suicidal statements, and this may seem like a no-brainer, but I like to talk about it because sometimes our kiddos fall into this kind of chronically maybe experiencing suicidality, or maybe they even use it as a way to avoid something. So I've had parents who experience that moment of maybe their kiddo saying, if you make me go to school, I'm going to kill myself, and falling into that pattern of using it as a way to avoid something that they're uncomfortable with. But we never want to say something like, oh, sure you will, and oh, you haven't done anything yet. We never want to do anything like that. Definitely want to avoid that as much as possible. And just, supervising your kiddos as much as possible, especially when they're experiencing these kinds of symptoms. I know it can be hard. You can't watch your kiddos always 24/7, but having some kind of check-in system can be really great, especially when they're, high school age, middle school, having some kind of check-in where they know you're going to call at this certain time, or you text them to check in can be a really great thing to do. So I just want to go over this really quick as far as treatment for depressive disorders. Research shows time and time again that oftentimes it's a combination of psychotherapy, so counseling, and medication. And that's not to say that medication is always needed, but oftentimes with like true clinical depression, it may be needed at some point. It may be beneficial, but we in the counseling and social work world, we definitely recommend therapy if a child's going to be receiving medication, and to try therapy first, because that kiddo really needs to build those internal coping skills. And so now we're going to move on to coping skills and strategies. So the first one on here is cognitive restructuring. That's just a fancy way of saying how to transform a thought. So taking a negative sort of thought and making it a little bit more rational or positive. So what I like to do as a clinician is kind of personify maybe the depression or anxiety. If it's a younger kiddo, I might say things like, where is the sadness talking here? Or where are your worries talking here? So I'll just give you a quick example. You might have a kiddo who is catastrophizing. So they might say something like, I'm so nervous for this test. I'm going to fail it. If I fail this test, I'll fail 8th grade. Then I'll fail high school. Then I won't get a job, and so on and so forth. So what you would do as the parent is help them to kind of separate that thought, kind of look at it from like an outside perspective, and kind of recognize some of the irrational thought process there in a gentle and calming way. Of course, we don't want to judge. Next up, I have your kiddo write out affirmations. So this could be your kiddo writing it out, or it could be maybe a message that even you sent. I'll have kiddos pull up text messages from mom or dad or grandma and grandpa, and they'll look at it when they start to feel down at school. I'll also do something with my kiddos where I'll have them recall a favorite memory. And what we'll do is we'll go through kind of the sensory experience of it. So for example, if it's something like visiting grandma, we'll talk about like, what do you see at grandma's house? What do you hear? And what do you smell, even making it a more grounding exercise, which can be a really good way to take them out of that fight or flight mode. Next up, we have deep breathing. You can never underestimate the power of deep breathing. There's so many different strategies out there. I'm going to have you practice one in just a second. But again, it's so great in taking us out of our fight or flight, or even with somebody who's feeling depressed and in that low zone, it can help bring them back into their body and make them feel a little bit more connected. Progressive muscle relaxation, that's another fancy term. And that is basically when you're tensing your muscles and relaxing them. So that's another great strategy. And there's so many things online, I feel like now, which is so great. There's so many scripts, YouTube videos, demonstrations of things where you can kind of maybe learn yourself, or you can just take a script and lead your child through a quick mindfulness moment. So mindfulness I also have on here, and deep breathing and progressive muscle relaxations are really examples of it. I know it's definitely a hot topic right now, and we're going to practice just a quick example of one in a second. And finally here, exploring their support system, asking them directly who are kind of your go-to people, who do you feel like you can talk to when you're feeling scared, if you're feeling upset, and recognizing that sometimes that's not always you as parent or guardian, and knowing that that's okay. I think especially, again, middle and high, sometimes it's harder to talk to mom and dad. They might feel more comfortable with, say, a grandparent or another family member, and that's not always the case, but just being willing and open to learn who their support people are, and open to whatever coping skills work for them. Kids are really creative, and I feel like the more creative they are and the more they're involved in their coping kind of skills and strategies, the more buy-in there's going to be. So that's going to be way better in the long run. So we're going to practice here really quick. So like I said, I'm going to lead you in a mindful moment. This is an example of what we call a body scan. And so I'm going to lead you through it. It's really quick. I want you to focus on your breathing throughout. And so I want you to breathe in through your nose and out through your mouth. What I do is in through 4, or in for 4, and then out for about 6 or 7. You don't have to worry too much about the count. What I want you to focus on is really getting just like a deep belly breath throughout it. And we'll talk about it really quick after. So I want you to start by noticing your brain. You can close your eyes if you feel comfortable. Observe thoughts that pop up in your brain right now. Don't get too involved with your thoughts. Simply notice them. Say to yourself, I notice I'm thinking. And what are you feeling? Which emotions are you experiencing at this moment? Try not to get too involved with your emotions, just simply observe them. Think to yourself, I notice I'm feeling. And without judgment or trying to change anything, simply observe your brain. Now observe your body. Notice your posture. How are you sitting? Are your shoulders and back slumped, or are you sitting up tall? Do you have your head up or down? Are both feet touching the floor? Notice any places in your body that feel stressed, tense, or tired today. Notice any places in your body that feel open, relaxed, or strong. And without judgment or trying to change anything, simply observe your body. And finally, begin to notice your breathing. Which parts of your body move as you breathe? Notice your chest, ribs, back, and shoulders. They naturally rise and fall with each breath like ocean waves. How much space is in between each breath? And is your breath long or short? And without judgment or trying to change anything, simply observe your breath. And when you're ready, slowly blink your eyes open and return your attention to the room you're in. So this is just a really quick example of something that I use with my kiddos. Some kids really like to just listen to your voice kind of going through this script. And it's a great way to talk to them about what we notice when we're actually still and focused on our body, because we're rarely, I feel like, doing that. And again, this can be something that helps kind of calm a kiddo down if they're in that fight or flight, or bring them back into their body if they're feeling disconnected. So now I'm going to turn it over to Kristen.
Perfect. We don't have any questions as of now, but thank you guys who commented on the slight echo. We'll go ahead and make sure we mute ourselves when the other one is talking, just to decrease the echo. So I am going to take us into anxiety. So for the purpose of this session, I think it's helpful to all have the same definition to work from. So we're going to define anxiety today as the persistent feeling of worry, nervousness, and unease. And this can look a lot of different ways depending on your kiddo. So you can even think about yourself as I talk through this, or your kiddo or multiple kiddos. But first, there's emotional symptoms. That might be restlessness, irritability, that crabbiness sometimes, and anticipating the worst, kind of like the sky is falling, catastrophizing, like Krista mentioned. But then also, I think it's important to talk about those physical symptoms. So that can be upset stomach, sweating, insomnia, unable to sleep, and shortness of breath. There can be more, there can be less. Every kid and person is different. But I know sometimes that upset stomach I see a lot. Maybe it's before a certain period. And to me, I'm like, maybe we got some anxiety going on and it's not just about the stomach. But that's some examples of the symptoms. And let's roll into the do's and don'ts. So if our kiddo is experiencing anxiety, some of the do's. So listen and try not to pass judgment, be a safe place. That can be hard to do. If I'm being realistic, that can be hard to do. You know, if you're a parent and you have multiple things going on and you're super busy and maybe your kiddo is really stressed and anxious about where to sit in the lunchroom. And to sometimes as an adult, when you have all this stuff going on, that doesn't seem like a big deal. But if we meet the student, you know, where they're at, that's a huge deal for them. And that's so big. So just trying to meet them where they're at and not judging what's going on. And collaborate about what interventions could be helpful. Collaboration is so huge, especially when our kids are in those younger grades when they don't really have control over anything. Nothing really, their schedule, what they're doing, everything's pretty much planned for them. So collaborating on what ideas can help them. And what this might look like is, let's say you sit down with your kiddo and they, you know, don't want to go to school anymore. And you're like, well, how can we work this out? And they can give some ideas. They might give some silly ideas like, well, we should just move, you know, to Canada and I never have to go to school again. And my suggestion is, instead of outright, you know, denying that idea, just say, that's an idea. Do you have anything else? And you can kind of keep building until you can come up with an approach that, you know, works for both of you. But that collaboration is so huge and can be helpful. Also, introduce relaxation techniques. I'm going to go through those too. Krista already talked about a few, but just maybe some deep breathing, that kind of thing. Praise small successes. So let's say our kiddo, you know, there's a certain class they don't like and they tend to skip it. I'm going to give that example. And they tend to skip it every day. And let's say there's a week where they only skip it 3 times instead of 5. That is a win. And let's praise that. We'll work on, you know, attending the other classes. But for now, any kind of success should be praised. Teach and encourage positive self-talk statements. One thing, working in an elementary and a middle school, it's crazy to me that all my kiddos know what negative self-talk is. That's saying statements that aren't very nice to ourselves. So if we're getting ready to take a test and they're saying, oh my gosh, I didn't study, I'm going to fail, that would be negative self-talk. So we want to flip the script and we want to encourage positive self-talk statements. Like, I got this, you're okay. So teaching those and trying to remind them to use them. And then finally, discuss alternative solutions to difficult situations. And what I mean by that is sometimes when we're so anxious or our kiddo is so anxious, they think there is only one path that they can choose. There's only one way, and they just are having a hard time seeing alternative paths. So just encouraging different avenues, brainstorming, that collaboration piece. And whenever we have do's, we also have don'ts. So things to maybe consider doing less or not doing would be minimizing and judging feelings. So if we go back to that example of being very anxious about where to sit at lunch, like I said, that might be the biggest thing going on for your 8th grader. But for you had a tough day. So trying not to minimize what they're going through and judging it, because that's the biggest thing in their world as of right now. So keeping that in mind. Also using comparisons. I'm going to give a silly example, but my grandparents used to tell me all the time how they used to walk to school, 3 miles one way and how hard it was. And So it's funny now, but at the time when I was maybe going to my grandparents for, advice because I was anxious about something, hearing how they had it, maybe so much harder didn't help me in the moment and actually kind of made me feel bad. So just keeping in mind, we usually compare to help someone out, but that typically doesn't help. So just being mindful of that. And also, lastly, offering only one way to resolve a situation. So, maybe telling the kiddo, this is the only way it's going to work out. You got to do it this way. Because if they're not able to attain it, then that just doesn't feel good. If they feel pretty down on themselves on top of already being anxious. So those are some of the don'ts. All right, and strategies. This is the fun part. I love stuff that you can take home today. So also, like Krista said, the cognitive restructuring. So I think of like literally listing out maybe the big anxious thought that is really consuming your kiddo. Let's write it out because that's important too, to just get it out of the head, get it on paper. So let's write it out. And then let's look at it. So maybe it's like what Krista said, I'm going to fail this test and then I'm going to fail 8th grade. And then I'm not going to be able to go to school with my friends anymore because they're going to go on to 9th grade and I'm stuck in 8th grade. And before you know it, we're going down the rabbit hole. So let's write out what would happen if we failed a test. I mean, doesn't mean we're going to fail the class. Does the teacher offer extra credit? All these different statements we can write next to that, anxious thought to kind of ground ourselves back in reality. This can be something your kiddo can do on their own, or you can do it together collaboratively. Next, we have relaxation techniques Krista touched on. So that's deep breathing. That's the progressive muscle relaxation. I really love a lot of these. And like she said, you can find scripts on YouTube. You can find short videos on YouTube and for different age ranges. You can do grounding exercises. I'm actually going to pause on this one for a moment because we're going to practice this one together. So I don't want to give too much away yet, but we'll come back to it. Mindful breathing. Some students love this. Some students don't love this, and that's totally okay. You just got to find out what works for them. But one mindful breathing technique that I personally love is the hand tracing breathing. So I'm going to do it as an example showing you, but I always tell my students they can do it under their desk discreetly and no one knows what they're doing. It just kind of looks like they're, fiddling with their hand or their pants or something. So you have your hand and you start right here at the knuckle. And when you inhale, you trace up your finger and you exhale on the down. So inhale, exhale, and you trace all the way to here. And then you do it back. And that can just help you reset. You might still have anxious thoughts lingering, but that's okay. We just want to do the mindful breathing to pause and try to get ourselves grounded back in the moment. And again, I'm all about things that students can do in class without other people knowing, kind of discreetly. Positive self-talk, creating the own mantra. That is something that's so huge. So some students I encourage to make their own mantras because I could give them, I could tell them to say, I got this, I'm okay, I'm smart. But that might not sound right for them. So I encourage them to use their own lingo, whatever the cool phrases are right now that are appropriate, And the best example I have is I was working with a 2nd grade girl and she loved unicorns and unicorns were like the best thing for her. So her positive self-talk statement, I wanted her to make it herself. And she came up with, I'm made of glitter. And to her, the unicorns were made of glitter. So that was like, that's the pinnacle if she said that to herself. I didn't really understand it, but I didn't have to. So that was fine. So whenever I saw her in the hallway, she'd be like, I'm made of glitter. I'm made of glitter. And it was wonderful. So encouraging those positive self-talk statements. And finally, checking in with support system. And as Krista mentioned, that might be teachers, that might be friends, that might be grandparents, might be parents, coaches, making sure we have that safety net of people to check in with. And one last strategy I like to tell parents who maybe have kiddos in the older grades. Sometimes when they get to high school and you ask them about their day, they might say, fine, good. And sometimes you want a little more out of them. So one technique or strategy I love to give parents is to ask them, on a scale of 1 to 10, 1 being the worst day ever and 10 being like, it was amazing. I can't wait to tell you about my day. Have them pick a number. And then let's say they give you a 5 right in the middle, which some high schoolers will do. I always like to say, what made you a 5 instead of a 4? Because then that makes them explain more what went on their day without looking like I'm picking too much. So that could be a great strategy to use and try out for your kiddo. All right, and let's practice. So we are going to go ahead and practice the grounding strategy of 5, 4, 3, 2, 1. Again, this can be done with your kiddo at the table. You can talk about it in the car, whatever, or they can do this silently in their head before a test, which I have a lot of students do to get back into the moment. And what it is that we are going to engage all 5 of our senses to get back into the moment and not let our anxious thought carry us away. So first, if everyone just finds a comfortable spot and just sit and kind of look around and notice, we're first going to do, what are 5 things that you can see right now? No judgment, but what are 5 things you can see? I can see, there's a window in here. I can see my phone. There's a table, a paper, and a pen. Perfect. Now we have 5. Let's go on to 4 things you can feel. And I always tell students that they can't touch other people. So I don't want them like grabbing onto their friend, when they're doing this exercise. So what are 4 things you can feel? I can pick up the pen. I can feel that. I can feel the desk. I can feel my sweater on my arms. And actually I have a watch on. So I felt my watch as I was touching my sweater. So those are 4 things I can feel. 3 things I can hear would be, I can hear myself talking. I can hear a vent going kind of in the side of the room. And I can hear my rings clinking because I talk with my hands. So they've been clinking as I've been talking. And 2 things that you can smell. This can be kind of hard because students might not have access to things they can smell. But sometimes I have students really breathe hard and they're like, it just smells cold or warm, depending on the temperature of the room. That's perfect. So kind of smells cold. And then also if students have like lotion with them, sometimes my girls have this, my boys sometimes don't have lotion, but if they can put it in their hand and just to kind of take a smell of it, and that can help ground them. If there's nothing they can smell, think of their 2 favorite smells. Maybe that is a garden, the ocean, grandma's house, that kind of thing. And finally, 1 thing they can taste. This can also be hard if they don't have candy or gum or aren't allowed to have those things in school. They can think of their favorite taste. So maybe they can think of like pizza or ice cream or something like that. So as they walk through all of these, we're now finished. And that's so helpful for them because it took them a moment to pause from their anxious thought to get back into the moment. So I hope this was something that you guys can use for yourselves, use for your kiddos, that kind of thing. And I just wanted to look, it doesn't look like we have any questions as of now. So if it's okay, I'm going to keep rolling into our last topic, which is going to be suicide. So I think it's always great to start out with some stats just to kind of get a grounding. So understanding suicide. Suicide is the 2nd leading cause of death among persons 10 to 14 and 15 to 24. We picked out these specifically because they tend to be our school age kiddos. And these are from the CDC statistics in 2018. That is the newest information they have available. I know their past ones, the last batch of data in 2017, it was still the 2nd leading cause of death. So that's been pretty consistent. And you can find that on the CDC website. And to also kind of look is 1 in 6 students report seriously considering suicide of high school age students. So to kind of bring it home a little bit, so in Westerville City Schools, as an example, we have over 1,500 high school students. So that is a rough estimate of 250 students. And just to give you an idea, we are within those national average. Westerville is not higher, Westerville is not lower. We are in there. But the good news is that we have licensed clinicians in our buildings. And this is something we are aware of. This is something that we are constantly, working on, talking about. It's not something that we're, not bringing to light. And the last part I kind of want to put here. So Westerville does have a board policy about suicide. So I want you to know that this is something that we absolutely talk about. It's in our policy. So that policy number is there. You can Google it if you ever want to look at it, but wanted to kind of put that on there. Okay. So let's move on to some myths and facts about suicide. And first of all, I just want to say thank you to everyone that is still joining us right now. We talk about this. It's a pretty heavy topic. And I think it's just so great when we can let it out into the open and discuss it. So I really appreciate you guys being here today while we are talking about this. So myth number one, if I ask my student about suicidal ideation, I'll put the idea in their head. And we've read and seen a ton of research on this, and that is a myth. So the fact is, asking someone about suicide won't make them more suicidal. Actually, the kids that I talk to are just so thankful that we brought it up and they could get it off their chest and have someone else to talk about it. And that's the great thing, because we don't want any kid to be thinking about this alone. We want to be in on the conversation and be able to have dialogue about it. So asking a student about it is not going to put the idea in their head. In fact, actually, it really helps to bring it out into light. Myth number two, if a student really wants to die by suicide, there is nothing that I can do about it. And the fact in here is that suicide is preventable. Even students at the highest risk for suicide still have part of them that wants to live. And that's where we come in and we want to talk about those protective factors. You know, what is keeping you here? It might be your friends, your family, your pets, you know, your sports team, your coach. And we're going to talk about those, and we're going to build on those as we work through everything. So, suicide is preventable. And I think that's just a really big take home. And myth number three, students who talk about suicide all the time are not actually suicidal, and therefore you do not need to take them seriously. And the fact for this is that youth who make suicidal statements typically have some risk for suicide, and all suicidal statements should be taken seriously. So kind of to put an example, in here, I know when every student that, you know, I work with, whether it be middle school or elementary school, if there is a statement about suicide, I am clinically assessing them, and we are contacting parent and we are working through this. It is not something that I'm ever going to blow off, and for two reasons. One, if a student has made claims in the past over and over and they make them again and they truly are thinking about this time, I want to be the one to catch that. I'm not going to let that slide. I am going to be there to support them, to walk with them through that. And then also, if a student is just saying it, you know, just to say it, then I'm going to go through the process every time, and eventually they get sick of me. So I had a student one time that was like, I'm not going to say that around you because I know you're going to call my mom. And I'm like, absolutely, yes, I will. So every time, you know, I'm going to do an assessment, and no matter what. So that is just something that's really big, that we make sure to do here in the district. And I am going to go ahead and give it back to Krista to finish up the topic of suicide.
Alrighty, thank you, Kristen. So what I want to talk about now is risk factors to suicide. So we're going to go through these. Again, it's not limited to just this, but these are some of the most common risk factors that we look for as clinicians and that you can keep in mind as parents. So previous suicide attempts. So if you have a kiddo who has, you know, maybe attempted suicide or has maybe have some self-harming behavior, that's going to be a risk factor for suicide. Any kind of history of mental health in the family, mental illness, depression, family history of suicide or violence is going to be another risk factor. Alcohol or drug abuse is also something that we look for. Family history of any kind of abuse or mistreatment. Also, do you mind, Kristen? Can you go back? There you go. Okay, no, you're fine. Physical illness is another one. So if you have a kiddo who is already experiencing a chronic physical illness, then that is going to be a risk factor for suicide as well. And obviously, with all of these, that doesn't automatically mean that your kiddo is going to be maybe experiencing suicidality, but it's going to put them more at risk. Let's see, what did I not? History of abuse or mistreatment, like I said. And then school, you know, overall relationship with school. So if it's a negative one, if they're experiencing a lot of school discipline, expulsions, suspensions, that's going to be a risk factor. So we always, you know, try to pay attention to, are our kiddos just really stressed when they're coming to school? Do they really dislike school? Because that's something that we're going to want to pay attention to, and we're going to want to help that sort of relationship to the school community. And then on the other hand, next up, we're going to talk about protective factors. So I think that oftentimes people think, with social workers and counselors, they're only going to look at what are the signs, what are the risk factors, but we also look at those things that are protecting that child from suicide or other mental illness. So first on the list is support. So when it comes to how connected they feel to their community, to their friends and family and school. That's going to be, in my opinion, the biggest protective factor. I feel like research shows time and time again that we're social creatures and we need to know that, people are validating our feelings, they understand it, they're normalizing our experiences. And if we get that type of support, it's really going to protect us, even as we're experiencing something like suicidality. Um, Learned skills is another one. So this might be something like anger management, stress management. And I think these are really important. Oftentimes, I think that we just assume that people are born with these. They automatically have these kinds of skills, but we do learn them over time and we can be taught. So the more confident a kiddo feels in these different kinds of skills, the more protected they're going to be for something like suicide or even depression or anxiety. Access to medical and mental health care. So I feel like that's, kind of a no brainer. And it's a tough one because sometimes it can be really hard to get that access. Sometimes, we're faced with really long wait lists and we're not really sure even where to look to find maybe a counselor or a psychiatrist. And it can feel really overwhelming. But the more, more confident we feel in terms of where to look with therapists or if we have access to one, that's going to be a protective factor for our kiddos. And we're going to talk about some resources here at the end. So that will be coming up too. Cultural and religious beliefs that discourage suicide is another one. This one I think is a double-edged sword. I think that while it can be a form of coping, we have to really talk to our kiddos because sometimes with religious beliefs, it can cause distress depending on how a kiddo is perceiving it. So with that, we just want to explore it more. If it is, at the top of the list, as far as the way that kiddo is coping maybe with suicidal thoughts, then that's going to be a huge protective factor. And finally, restricted access to lethal means. So whenever we're assessing a child, if they're presenting with signs of suicide or maybe they're even verbalizing that they're thinking about suicide, we're going to look at, do they have a plan? Are they thinking of any ways that they want to harm themselves? So the more that we can restrict access to any of these, lethal means, the more protected a kiddo is going to be. And then next up, I have warning signs for suicide. And I know there's a lot on this page, and I'm going to kind of jump around a little bit. But first, I just want to say that there are warning signs to suicide. I feel like this is another myth out there that you're not going to know if somebody's thinking about it. You're not going to be able to stop them, kind of like what Kristen said earlier. But there are warning signs, and what we can do as caregivers is really pay attention to our kiddos' behaviors, what they're telling us, changes in school. There's so many different things that we can pay close attention to. So some of the key ones here that I want to highlight is definitely that withdrawal. So isolating again from friends and families if they're not participating in those kind of extracurricular activities. That's going to be something that we want to talk to them about it. We want to explore, why aren't you participating in this anymore? You used to love, being part of drama club or whatever it is. Um, Marked personality change is another one I kind of wanted to talk about. I think that can be another important indicator. If all of a sudden a kiddo is really presenting themselves very differently, then it doesn't mean that it's a sign of suicide, but you want to, ask more about that and why the sudden change and kind of how they're presenting themselves. And going along with that, just the way they're presenting themselves, like their appearance, are they kind of lacking hygiene? So like an unusual neglect of personal appearance. That's going to be something else. Like that we're going to want to ask more about. Loss of interest in activities, not tolerating praise or reward. I think that's another one that should raise some red flags for us. So if you have a kiddo who all of a sudden is just not reacting to those kinds of affirmations and really praising them when they do well, that's going to be something that maybe something's wrong, maybe not, but we want to find out more. And then obviously here, verbal hints. So, you know, kiddos will verbalize. It doesn't always come right out as, I'm thinking about suicide, but it can come out in different ways. Giving away possessions as well is an important one to kind of take note of, or writing any kind of goodbyes. Those are going to be the more obvious signs of suicide. Um, and very, very important to take seriously. Like Kristen said in the previous slide, if a kiddo is verbalizing something about suicide, it's okay to talk about it. It's okay to ask more and just listen to, what your child is thinking and what they're feeling. And then lastly here, I do have sudden upswing. So sometimes we'll see this where maybe a kiddo has gone through a long kind of depressive state and we're really working on that, but then all of a sudden out of nowhere, there's this sudden upswing. We want to take note of that as well. And I think that's kind of a sneaky one, right? We might just assume like everything is fine, but we want to just check in and make sure and ask those more serious questions. So, Kristen kind of said this earlier, but I know some of this is really heavy information, heavy material to listen to, especially, given any kind of maybe family experience or personal experience. So, definitely, remember your own self-care. I think that that's an important one. No matter what, take care of yourself. Um, and that's going to make you an even better parent and caregiver. And I know it's way easier said than done, but if you find yourself even after this presentation feeling kind of the effects of maybe listening to some of this material, take care of yourself. And I think come at things, what your child is maybe telling you or presenting with, come at it with curiosity and open-mindedness. I feel like that's one of the best things that you can do. So, having said that, I want to go over some of these resources. So, first on the list, we have Children's Crisis Hotline. So, this is a 24/7 psychiatric hotline. You're connected with a crisis counselor. This is a great resource. We use this one at school. We recommend this to parents all the time. So, definitely, you could even jot it down just to have it with you. Definitely a good resource to have. Second, here we have the Buckeye Ranch. So Buckeye Ranch is a great counseling agency. They have all kinds of different programs, and they have same-day assessments. I don't think that has changed with COVID, fingers crossed, but they're an excellent agency just to have kind of written down as well. Buckeye Ranch. Net Care, that is the adult mental health emergency counseling agency in this area in Central Ohio. Again, a really great resource, but that's just for 18 years and older. And then below that, I have Ohio's 24/7 crisis text line. So this is one that we give to kiddos quite often if they're maybe experiencing depression, any kind of depressive symptoms, if they're experiencing unsafe thoughts like suicidal thoughts or self-harm. Again, a really great resource for our kiddos. What they do is they text for hope to 741-741, and they're connected with a crisis counselor. Like it says there, it's 24/7. It's a great resource because I think a lot of our kids feel more comfortable with the texting. Not all, but a lot of them are like, oh, I didn't know that there was one of these that you can text. So a really great resource. And I encourage kids to use it even when, maybe they're concerned about a friend and they don't necessarily feel comfortable reaching out to an adult first. And they're always trying to teach that skill, right? But it's a good kind of thing for them to have in their back pocket. If they're at home, they're not quite sure, they can use this resource, and hopefully that crisis counselor is going to, walk them through that and encourage them to reach out to an adult. And then last year, this is an article that I just put on here. It's about taking your child to the ER in the case of a mental health emergency. So I like this one because again, it kind of normalizes some things and walks you through it, even if maybe you've experienced it and you kind of just want to read something just to sort of process. I think it's a good resource. And like Kristen said earlier, never hesitate to reach out to any of us. We have the student well-being website here again. We have, all in-house social workers at the high school level, and then we have Concord prevention clinicians at the middle school, but each elementary school is assigned a school counselor. So you can check out who your counselor is for your school. We work really closely with the school counselors and the in-house social workers. We definitely work as a team. So don't ever hesitate to reach out to any of us. And
Great. And before we move on to our last slide of the presentation, there was a great question that came through of when is a good time to start talking about suicide with my student. And this particular question was they have a 7-year-old. And Krista kind of already touched on this, but I would say, whenever they bring it up to you or talk, or you hear them talking about it, and absolutely have that curious mind with asking questions and trying not to have judgment right away, which is very hard because this is a scary topic. But to be able to be curious and have that conversation and that dialogue, with your kiddo. But I wouldn't say there's a hard and fast age that this, has to be done by this time. I would say go at the pace of your kiddo and kind of see, what they bring to you. And then someone also said that if they could get a link to the slides, and we are going to check on that for you. So that is something absolutely we're going to look into, because I know some of this information you guys obviously want in your hands too to refer back to. All right, so to follow up, you can put any last minute questions in the chat. That would be wonderful. We just want to thank you guys for attending this virtually. We want to thank the Parent Council and Westerville Education Challenge. We're just really thankful to still be able to get this information to you guys, even though it's virtually, made it kind of fun to navigate. So we just really thank you for taking the time to attend this online. We have a link here posted. There's also a QR code if you want to put your phone up to it and scan it. It's just a survey getting your feedback. I believe you'll also get an email afterwards that also has this link if you missed the chance to scan this code right now. But we just wanted to have a chance for you guys to give us feedback. If there's a question you think about later, you can put it in the feedback form with your contact information and we can get back to you. We just want to make sure that you guys have all the information you would want, and just know that we are here to walk this alongside you, and we really enjoy just the opportunity to work with all of your kiddos. So thank you guys for attending. We really appreciate it. We're going to go ahead and leave this link up for a little bit, but Krista and I will go ahead and mute ourselves and take our picture off so you can scan it, but the presentation will end in a few minutes, just so you guys know.